Did you know at least 4 people will be affected by cardiovascular disease during this 3-minute talk? That's a diagnosis every 43 seconds. While many of these people do receive treatment, that treatment often follows a general protocol. So they might either receive treatment unsuitable for them or will need to be retreated later on. This leads to cardiovascular disease being the #1 cause of death globally, affecting all of us directly or indirectly throughout our lives. Therefore, the Computational Cardiology Laboratory and myself developed computer models of the heart to help fight cardiovascular disease. Our models can be used as a clinical tool to support doctors in making clinical decisions, planning and improving therapies, and further predicting therapeutic outcomes. For example, such models give a sneak preview on how a clinical intervention, let's say a replacement of a valve, may turn out and how it may improve a patient's health state a few days after the intervention, as well as in the long run, let's say a few days, half a year after the intervention. The main challenge, however, is not only to build a generalized, complex computer model, but one that can be personalized to any patient. Simply speaking, we do not want to model any heartbeat, we want to model your heartbeat, the heartbeat of each individual patient. Our virtual models are based on a mathematical framework of partial differential equations, which mimic the physiology of the heart in terms of electrophysiology, how the heart becomes electrically activated, in terms of mechanics, how does the heart contract and relax again, and how blood flow influences the heart's behavior. The equations describing our models have multiple different parameters, which are unique for each patient. Clinical data, such as MRI images, ultrasound measurements, and pressure data from each patient are used as input to find those unique parameters. This is done using different mathematical approaches, such as machine learning, basically teaching a computer to do the work for us, optimization approaches, minimizing the difference between the model's outcome and measured data, and stochastic sampling, a statistical approach to find the solution in a bounded parameter space. Although we have some work to do until our models fully reach clinics, knowing what they're capable of and how beneficial they potentially are for the treatment of cardiovascular disease makes us speed up our research as much as we can. So from the bottom of my actual and my virtual heart, I hope we are going to be successful in our endeavors.